All right, paraneoplastic syndromes. So para means alongside of the neoplasm. So sometimes patients will actually have incidental lab results or signs on physical exam that are specific to certain types of cancers. And thus they're very helpful diagnostic clues. So there's signs and symptoms in addition to the cancer that are sometimes completely unrelated, but they give you a clue to what's going on with that cancer. These are called paraneoplastic syndromes. And we're going to go over some examples. These are very important for the USMLE, so pay attention and try to guess what they are. So, let's say someone has all these signs: osteoporosis, hypertension, buffalo hump, obesity, thin wrinkled skin, purple stria. What do they have? Cushing syndrome, right? Cushing syndrome. All right, what's it due to? Too much cortisol, right? And if we're thinking cancers, what hormone stimulates the release of cortisol from the adrenals? ACTH. Adrenocorticotropic hormone. And that is the paraneoplasm. So some cancers can produce ACTH and cause Cushing syndrome. What are those cancers? How about lung cancer, and specifically small cell lung cancers? Okay, so no small cell associated with ACTH. Next example. This person has very concentrated urine. They can't dilute their urine. They keep reabsorbing water. What do they have too much of? Antidiuretic hormone. Where does this act? The collecting ducts. It reabsorbs water from the collecting ducts, and too much of it's getting reabsorbed because too much ADH is being released. From what type of cancer? Again, small cell lung cancer. And other types of cancers, anything in the brain. Anything in the brain. So, intracranial neoplasms. All right, someone has lower back pain, and it's radiating to their groin. There's blood in their urine, and they also have some mood changes and constipation. What metabolic abnormality do you think is taking place, and what hormone do you think is responsible? So they have the classic, it sounds like they have a kidney stone, right? So stones, moans, abdominal groans, and psychic moans, all that rhyming goes along with hypercalcemia. And I gave away the answer here, but parathyroid hormone increases calcium, right? It reabsorbs and releases calcium from bone. Now, with cancers, it's not actually parathyroid hormone, but it's parathyroid-related peptide, parathyroid hormone-related peptide that causes this. It acts just like PTH, where it increases calcium, and what ion goes down? Phosphate. Phosphate will go down. So increased calcium, low phosphate, you're thinking too much PTH, and with a cancer, it's PTHRP. And what cancer is associated with this? A lot of squamous cell carcinomas, especially of the lung, like lung cancer, squamous cell of the lung, breast, and some others too. All right, what is Lance Armstrong doing up here? Let's say you have someone with a ruddy complexion, and they have incredibly high hemoglobin, significantly elevated. What hormone is too elevated in them, and what was Lance Armstrong doping on? Erythropoietin, EPO, right? And what cancer is related to this? Well, renal cell carcinoma is one. It makes sense because actually EPO is released in the kidneys, so that makes sense. But there's another cancer too, hepatocellular carcinoma. What was the tumor marker again for this? Alpha-fetoprotein, right? Remember that? Yeah. There's another paraneoplasm associated with HCC, and that is you can have someone with hypoglycemia. What do you think that hormone is released then? Insulin-like growth factor 1 lowers the glucose. All right, next paraneoplasm. Someone who's really tired, okay? They're fatigued. They have proximal muscle weakness, trouble standing from a sitting or recumbent position. They could have what? Paraneoplastic syndrome. anti-calcium antibodies. So antibodies to the calcium channels. Recall, and what's the syndrome called? Lambert-Eaton syndrome. So here's a neuromuscular junction, here's a nerve, and here's the muscle. So recall that when an action potential is traveling along the axon and it reaches the end, there's calcium channels on the very end that open up and allow calcium to flow in, and this causes the release of what? Of vesicles containing what neurotransmitter? Acetylcholine, that then goes and acts on acetylcholine receptor on the muscle and causes contraction of the muscle. So when you have an antibody against these calcium receptors, you will have no release of the vesicles and no acetylcholine and no contraction of the muscle. That's called Lambert-Eaton syndrome, and we can see that in a certain type of cancer. What type of cancer is that? Lung cancer. Very good. And what type of lung cancer? Small cell lung cancer again. Wow, the third type of paraneoplasm with small cell. What's that disease, speaking of antibodies and neuromuscular junction, what's the disease where there's an antibody against the acetylcholine receptor and you have weakness? That is myasthenia gravis. Here is darkening and thickening of a person's axilla, and they might even have it in the back of their neck too. What's this called? Acanthosis nigricans. That's what that's called. What are these waxy stuck-on lesions? Seborrheic keratosis, right? And when you have a crop of them come up like overnight or very quickly, this is a sign. This is called the lesser Trelot sign. And both of these things, this lesser Trelot sign and sudden increase in seborrheic keratosis or sudden increase in acanthosis nigricans, can be a sign of what type of malignancies? Gastric malignancies or of the viscera, so especially stomach cancer. What lymph node would you check for on physical exam? Virchow's lymph node, right? The left supraclavicular lymph node, because that's where most of the lymph drains, right? From like the abdomen and from the viscera. Time for a flash quiz. So remember all those paraneoplasms associated with small cell lung cancer? Well, let's run through them. What are they? Well, we said ACTH, ADH, and the anti-calcium Lambert-Eaton syndrome, all associated with small cell lung cancer. Very good. Psammoma bodies. I love psammoma bodies. What are they? Well, they're basically world calcifications that form when certain types of cancer cells undergo apoptosis and the leftover damaged phospholipids calcify. Do you remember what type of calcification this is from the pathology section? Dystrophic calcification. Good! I did teach you something. So there are 4 cancers associated with psammoma bodies. These are very important. Actually, the U.S. only loves to test psammoma bodies, so know them. And you can remember them easily by the word psammoma. PSMM. Those are the 4 cancers. So, the P, what does that stand for? Papillary adenocarcinoma of the thyroid. The S, serous. Cystadenocarcinoma of the ovary. It's oftentimes bilateral. We'll learn that later. The M, one of the M's. Meningioma of the brain. Another M, we talked about it earlier, icing on the cake. Mesothelioma. Alright, so let's briefly talk about cancer epidemiology. And we'll talk about men and women. We'll do it by gender. Let's discuss incidence first. So the number of new cancers per year in men first, okay? And then we'll talk about women. Most common is, for men, prostate, alright? Women, breast. So we got a P and a B. And then for men and women, it's easy. It's the same. Number 2 most common is lung. Number 2 for women, lung. Okay? So then an L for both. And third is what? What comes in third? Colon for both of them. So PLC, that's all I remember, is PLC and BLC for incidence, all right? It's the same for men and women for 2 and 3, but the first one changes up just depending on the gender. Only men have prostates and only women have breasts. So that's why those are the most common. Now that we know the most common, what is the most common causes of mortality? We know the incidence. What about mortality? And it's real easy. All you do is you make a little swap. Ready? Whoop! So the L and the P and the L and the B switch up, and instead of PLC, we now have LPC. And we have LBC. Alright? For cancer killer. It makes sense. Lung cancer is very bad. You don't want to have lung cancer. It's very deadly. Biggest killer, cancer-wise, in the United States. All right, finally, common metastases. This is going to be fun. It's easy. How about for the brain, huh? Well, there's a helpful little mnemonic for all of these, and for the brain, it is lots of bad stuff kills glia. Now, what does this all stand for? L stands for, what do you think? Lungs. B, breast. S, skin. K, kidney. And G, GI, the colon. So all that stuff can metastasize to the liver. What about skin? When I say skin, what's a weird one that metastasizes to the brain? Melanoma. That's a nasty one. All right, here's a liver, and here we see a bunch of metastases. So cancer sometimes penetrates benign liver. C stands for, well, what do you think flows most commonly into the liver? What's the portal vein carry? Transmits blood from the colon, right? So C stands for colon. S stands for another GI organ, the stomach, and the P, another GI organ, pancreas. All these things are from the portal tract, okay? It makes sense. And B, breast, and L, lung. All right? Makes sense. And finally, the bone. So, what's the mnemonic here? P.T. Barnum loves kids. That's very helpful. P stands for prostate. And by the way, some of these are osteoblastic cancers and some of these are osteolytic. So some form new bone, some stimulate bone growth, and some stimulate bone lysing. Prostate can stimulate bone growth, actually. So osteoblastic. So the T stands for thyroid, actually. Breast is B, L is lung, and K is kidney. Very good. So we're done. Now all we have left is a test yourself question, and we're done. Wow, you guys made it all the way through. You did such a good job. It was fun too, actually, wasn't it? So here's the question, though. You got to get past this first. You're not quite out of the woods yet. A 12-year-old boy who recently immigrated from Nigeria presents with a 6-month history of intermittent fever, fatigue, and night sweats. He has a large mass in his right mandible. Biopsy of the mass shows an interspersed pattern of macrophages with sheets of lymphoblasts, the so-called starry sky appearance. The pathogen associated with this patient's presentation also is associated with which of the following conditions? What do you think? Cervical adenocarcinoma, gastric adenocarcinoma, hepatocellular carcinoma, heterophile negative mono, or nasopharyngeal carcinoma? So, first of all, what is this kid's diagnosis? We saw it earlier. Remember that kid, the African individual, the endemic area with what type of cancer? I'll give you a hint. It involves the translocation of chromosomes 8 and 14 and the MYC proto-oncogene, and that is, giving it away here, Burkitt's lymphoma. So Burkitt's lymphoma. Do you remember the carcinogen? The microbe that was a carcinogen responsible for that? Epstein-Barr virus, right? Very good. Now, what else did this cause? We said that it could cause that Reed-Sternberg disease, that Hodgkin's lymphoma, right? Hodgkin lymphoma. We also said it could cause, in the nasopharynx, it can cause nasopharyngeal carcinoma. So it's got to be E. And it is. Makes sense. And you got it right. And real quickly, which pathogens associated with cervical cancer? That was HPV, right? Talk about that. 16, 18, 31, 33, remember? Yeah. Gastric adenocarcinoma was that Helicobacter pylori, right? Right. Hepatocellular carcinoma, we talked about those. Hepatitis B virus, hepatitis C virus with that inflammation, and it incorporated into the DNA, specifically hepatitis B does. Heterophile negative mono, well, that's what causes that cytomegalovirus, and that's another herpes virus, but not really associated with cancer. So you're done. Now that you know the pathology section, now that we went through the basics, this will help you with the rest of the book. So keep in mind these basic principles, and they'll serve you well. Good luck.